Have you ever turned away a celebrity because of a health concern?
I have turned away a celebrity more than once because of health concerns, and I think that that's part of being a physician. You know, we take a Hippocratic oath, and a lot of times what we see, recently in certain cases, physicians really don't follow that oath because they're too eager to get a patient in their operating room under the knife.
Why is that? You mean like a celebrity because of their name?
Because there's a certain cachet to having celebrity patients. I'm lucky to have a number of them, but I think part of the reason I have that is because I have a conservative reputation, not just with the surgery that I do, but also with looking out for the health of the patient and not indulging, their habits.
So what would cause you to turn them away? If a celebrity came to you and said, or any patient came to you and said, I want plastic surgery, what health concerns would cause you to say, we can't do this?
Well, I do extensive procedures and the patients are under general anesthesia. So any health concern like high blood pressure, cardiac problems, lung problems, even asthma, things like that, I need to know about. And if any patient has those problems, really no matter how old they are or what surgery they're having, I get a medical clearance and I don't hesitate to cancel the surgery if they don't pass the clearance.
When somebody gets a test before plastic surgery, what kinds of things are they tested for?
We test for, number one would be like an EKG, chest x-ray. Those are two very basic tests. We also get a thorough battery of lab tests. We test their electrolytes, we test their blood count, and really any other tests laboratory-wise that are indicated by any medical conditions that they have.
So what does that show? Does it show drug abuse?
It wouldn't routinely show drug abuse. That would be something that you would have to suspect in someone, and I have in past years gotten toxicity screens, toxin screens, to determine whether or not a patient is using a drug.
The drugs that were found in Whitney Houston's hotel, the Lorazepam, Xanax, Valium, even amoxicillin, if you were to see that show up in a toxicology test for someone, why would that put them in danger for surgery?
Well, those three drugs, Lorazepam, Xanax, and Valium, basically are all engineered to do the same thing. They're called anxiolytics. So if someone's on all three of those drugs, there's no question in my mind that that person is a doctor shopper and probably has gone to different doctors to get them. I'm not a psychiatrist. I don't prescribe those drugs often. And so it might be possible that someone with a major anxiety problem would be refractory to just one of the drugs, so that's possible. But it sounds like there was more going on, and someone who's a heavy drinker, that combination of drugs, that's a real problem.
As in the case of Anna Nicole Smith, she had different names. She would use aliases to go get prescriptions. How do doctors prevent that from happening?
That is a very good point. We do find that. Celebrities use aliases. So doctors have to know the alias and the pharmacy has to know if that's the case. And so that is one way that celebrities can get multiple drugs, and maybe that's one of the reasons why it happens with them more often. It's a really good question, and it comes up. But at the same time, in medicine, we are obligated to protect the patient's confidentiality. Obviously, the duty to protect the patient's health comes first. So you have to find some sort of compromise without sacrificing either one of those in order to prevent the patient from doctor shopping and from using that ability to have an alias to get multiple medications.
But what if they're using an alias not just because they're a celebrity, but because they want to get multiple bottles of the drug?
Right, and that happens too. I think some non-celebrities use other aliases, but it should be done by Social Security number. There are other ways that these people are able to get drugs as well, one of which is to have the drug written into someone else's name. That's something that I've refused to do in the past, and I won't do it just because of that potential for abuse.
Yeah. You write it in the actual celebrity's name?
In their name.
Do you think that because now we've had Michael Jackson, now we've had Whitney Houston, Heath Ledger, a few years ago, do you think is a wake-up call to doctors?
I think this case should be the biggest wake-up call of all, because Whitney Houston, while she certainly is culpable for her behavior over the years, and I think there was just something in her that made her do that, at the same time, this should just be a wake-up call. It's very sad. We're all sad about it. We lost a great talent, and I wouldn't fault doctors for the whole process, but at the same time, I think we need to be more active in preventing this kind of thing from happening.